Part A. Extract 1. Questions 1 to 12. You hear an endocrinologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes. Good morning, Mihiraa. How are you feeling today?
Good morning, nurse. To be honest, I'm quite concerned. I've been feeling fatigued for a while now, and it just doesn't seem to be getting any better.
I'm sorry to hear that. Could you describe the difficulties you've been experiencing in more detail?
Well, I've been extremely tired all the time, even after getting plenty of sleep. I also noticed that I'm bruising easily, and my gums bleed when I brush my teeth. My appetite has decreased, and I've been having frequent headaches. There's also this constant feeling of weakness, especially in my muscles, and I sometimes feel dizzy when I stand up too quickly. The symptoms have been persistent for a few months now, and it's really starting to worry me.
That sounds quite troubling. Have you tried any treatments or medications to alleviate these symptoms?
Yes, I have. I've been taking over-the-counter pain relievers like paracetamol for headaches, but they don't seem to help much. I also tried increasing my iron intake by eating more leafy greens and taking an iron supplement, thinking it might be anemia, but that didn't make any difference. I've even tried some herbal remedies like echinacea, but nothing seems to help.
I see. And have you been on any other medications recently, or do you have a history of any significant illnesses?
I don't have any major illnesses in my history, but I was on antibiotics about 3 months ago for a severe throat infection. I took amoxicillin for 10 days. Apart from that, I've only been taking my usual multivitamins. There's no history of chronic diseases or anything like that.
Thank you for sharing that. What about your family history? Is there any history of similar symptoms or other medical conditions in your family?
Not really. My parents are in their 60s and are generally healthy, though my mother did have rheumatoid arthritis. My older sister has a thyroid condition, but she manages it with medication. There's no history of anything like this persistent fatigue or bruising in the family.
Thank you for providing all this information. Let's go ahead with a physical examination to get a better idea of what's going on. I'll check your vital signs first. Your blood pressure is 110/70 mmHg, which is within the normal range. Your pulse is slightly elevated at 96 beats per minute, and your temperature is 36.8 degrees Celsius. Your respiratory rate is 18 breaths per minute, which is also normal. However, I do notice some pallor in your skin and slight swelling in your gums.
Is that something to be concerned about?
It could be. Based on your symptoms and the examination, I'm inclined to suspect leukopenia, which is a condition where your white blood cell count is lower than normal. This could explain your susceptibility to infections, the bruising, and your overall feeling of weakness. But we'll need to do some blood tests to confirm this diagnosis.
I've never heard of that. What causes it, and how is it treated?
The condition can be caused by a variety of factors, including certain medications, autoimmune diseases, or bone marrow disorders. Treatment typically involves addressing the underlying cause. If your tests confirm the condition, we may prescribe medications to stimulate white blood cell production or modify your current treatments if they're contributing to the problem. In the meantime, I recommend continuing with a balanced diet rich in vitamins and minerals, and will likely suggest avoiding any situations that might increase your risk of infection.
I see. What happens next?
We'll schedule you for a complete blood count and possibly some other tests to get a clearer picture of what's going on. Once we have the results, we can discuss the best course of treatment. I'd like to set up a follow-up appointment for you in about a week. Does that work for you?
Yes, that sounds fine. Thank you so much for your help, Nurse True.
You're very welcome, Mihiraa. We'll get to the bottom of this and make sure you're on the right path to feeling better.
Extract 2. Questions 13 to 24. You hear a plastic surgeon talking to a patient called Mihiraa. You now have 30 seconds to look at the notes. Good morning, Mihiraa. I'm Dr. Marcus Max. How can I help you today?
Good morning, Dr. Max. I'm here because I'm really worried about my son, Morris. Lately, he's been showing some unusual behaviors that are starting to concern me.
I see. Can you describe what's been happening? What behaviors have you noticed that are causing you concern?
Well, for the past few months, Morris has been very anxious about things being dirty or not in order. He washes his hands constantly, sometimes for 10 or 15 minutes at a time. He also gets upset if his toys aren't arranged perfectly or if something is out of place. It's like he can't focus on anything else until everything is exactly how he wants it. It's getting worse, and it's affecting his sleep and schoolwork. He seems frustrated and even cries when he can't make things perfect.
That does sound concerning, Mihiraa. It must be very stressful for both you and Morris. How long has this been going on, and has anything in particular triggered these behaviors?
It started about 6 months ago, but it's really escalated in the last few weeks. I can't think of anything specific that triggered it. We haven't had any major changes at home or in school. But I'm worried because my father had similar issues when he was younger. He used to spend hours checking things and was very particular about cleanliness. I'm starting to wonder if it's something hereditary.
It's very possible that there could be a genetic component to this, especially given your father's history. From what you've described, it sounds like Morris may be dealing with symptoms of obsessive-compulsive disorder. It's a condition where people experience persistent, unwanted thoughts that cause them to perform repetitive behaviors in an attempt to relieve the anxiety caused by these thoughts.
That sounds exactly like what Morris is going through. What can we do about it? Is there a way to help him?
There are definitely ways to help Morris. First, I'd like to arrange for a comprehensive psychological assessment to confirm the diagnosis. This would involve a series of interviews and questionnaires that will help us understand the extent of his symptoms and how they're affecting his daily life. We may also conduct some basic lab tests to rule out any other underlying conditions that could be contributing to his behavior.
Okay, and after the assessment, what would the treatment involve?
Treatment typically involves a combination of cognitive behavioral therapy and medication. This is very effective as it helps patients learn to manage their anxiety and reduce the compulsive behaviors. Specifically, a type of CBT called exposure and response prevention is used, where Morris would gradually be exposed to his fears in a controlled way and learn to resist the urge to perform his rituals. In terms of medication, we often use selective serotonin reuptake inhibitors like sertraline. These medications can help to reduce obsessive thoughts and compulsive behaviors, but they can take a few weeks to start working.
How long would the treatment take?
The duration of treatment can vary. The key is consistency and following the treatment plan.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a nurse called Mihiraa talking to a physician. Now read the question.
Dr. Paul, I'm concerned about Mr. George's breathing. He seems to be having difficulty breathing, and I've noticed a wheezing sound.
That's concerning. Can you describe the wheezing sound in more detail, Mihiraa?
It's a high-pitched whistling sound, especially during exhalation. It's getting worse over time.
Wheezing is often a sign of airway obstruction. It could be due to several factors, such as asthma, bronchitis, or a foreign object in the airway.
I've checked his medical history, and he doesn't have a history of asthma or bronchitis. Could it be related to his recent chest X-ray?
It's possible. Let's review the chest X-ray and consider other potential causes. We might need to order a pulmonary function test to assess his lung function.
I'll inform Mr. George about the need for further testing. I'm concerned about his comfort level. Should we administer oxygen?
Let's monitor his oxygen saturation levels, Mihiraa. If they drop below 90%, we can start supplemental oxygen. It's important to keep him comfortable and manage his symptoms until we can determine the underlying cause.
Now look at question 26. You hear a doctor called Mihiraa talking to a patient. Now read the question.
Mr. Paul, I'd like to discuss the importance of measuring your serum amylase levels. This blood test helps assess the function of your pancreas.
I'm not sure what amylase is. Can you explain, Dr. Mihiraa?
Amylase is an enzyme produced by the pancreas. It plays a crucial role in digesting carbohydrates. Elevated amylase levels can indicate pancreatic inflammation, which can be a serious condition.
I see. Why is it important to monitor my amylase levels?
Regular monitoring of amylase levels can help detect early signs of pancreatic problems. This allows for prompt diagnosis and treatment, which can improve outcomes.
Dr. Mihiraa, are there any specific symptoms I should watch out for?
Abdominal pain, especially in the upper abdomen, can be a symptom of elevated amylase levels. You may also experience nausea, vomiting, or fever. If you notice any of these symptoms, it's important to seek medical attention. Now look at question 27. You hear a doctor called Mihiraa talking to a parent. Now read the question. Mr. and Mrs. Paul, I'd like to discuss the importance of brain imaging for your child Annie. Given her symptoms, it's essential to rule out any underlying neurological conditions.
We understand, Dr. Mihiraa. What type of brain imaging would you recommend?
A CT scan or MRI would be appropriate. These imaging tests can help visualize the structure and function of the brain.
Are there any risks associated with these procedures?
Both CT and MRI scans are generally safe. However, MRI scans involve a strong magnetic field, so it's important to inform us if your child has any metal implants or devices.
Annie doesn't have any metal implants. Can you explain the difference between CT and MRI scans?
CT scans use X-rays to create images, while MRI scans use magnetic fields and radio waves. MRI scans provide more detailed images of soft tissues, which can be helpful in diagnosing certain conditions.
We'll follow your recommendations, Dr. Mihiraa. We want to ensure Annie receives the best possible care.
Now look at question 28. You hear an occupational therapist called Mihiraa talking to a physiotherapist. Now read the question.
Evan, I'm concerned about Mr. Paul's progress in physiotherapy. He seems to be struggling with the exercises, and his mobility hasn't improved significantly.
That's interesting. Have you tried adjusting the exercises or using different techniques, Mihiraa?
Yes, we've tried various approaches, but he's still having difficulty. I'm wondering if there might be an underlying issue affecting his recovery.
Perhaps we should consult with a neurologist to rule out any neurological factors. Sometimes, underlying conditions can hinder rehabilitation progress.
That's a good idea. I'll schedule a referral. In the meantime, we could try incorporating occupational therapy techniques to address any functional limitations.
That's a great suggestion. Occupational therapy can help with activities of daily living and improve overall independence.
We should also consider the patient's motivation and emotional state. Sometimes, psychological factors can impact rehabilitation outcomes.
Absolutely, Mihiraa. We can involve a social worker to provide emotional support and address any underlying issues.
Now look at question 29. You hear a doctor called Mihiraa talking to a nurse. Now read the question.
Nurse Paul, I'm concerned about Mr. George's recent symptoms. He's been experiencing persistent fatigue, weight loss, and night sweats.
Yes, Dr. Mihiraa, I've noticed those changes as well. He also seems to be having difficulty concentrating.
Given his symptoms, I suspect an underlying medical condition, possibly a thyroid disorder or anemia. We'll need to conduct some blood tests to investigate further.
That makes sense. I'll schedule the blood tests and inform Mr. George about the need for additional testing.
It's important to address these symptoms promptly, as they could indicate a more serious underlying issue. We'll monitor his condition closely and adjust treatment as needed.
Dr. Mihiraa, will you be able to see him for a follow-up appointment soon?
I'll schedule a follow-up visit within the next week. We'll discuss the test results and determine the appropriate course of action. Now look at question 30. You hear a GP called Mihiraa talking to a care home manager. Now read the question. Mrs. Paul, I'm concerned about Mr. George's recent decline in health. He's been experiencing increased fatigue, confusion, and loss of appetite.
Yes, Dr. Mihiraa, we've noticed those changes as well. He seems to be losing weight, and he's not as active as he used to be.
It's important to investigate these symptoms further. I'd like to arrange a comprehensive assessment, including blood tests and a physical examination.
That sounds like a good plan. We're worried about him, and we want to do whatever we can to help.
I understand. I'll schedule an appointment for Mr. George to see a specialist who can evaluate his condition in more detail.
Is there anything we can do at the care home to support him during this time?
It's important to monitor his vital signs closely and ensure he's eating and drinking adequately. If he's experiencing any pain or discomfort, please let us know. That is the end of Part B. Now look at Part C.
Part C. Extract 1. Questions 31 to 36. You now have 90 seconds to read questions 31 to 36. You hear the conversation between a microbiologist Dr. Mihiraa and an interviewer. Good day, Dr. Mihiraa. Thank you for joining us today to discuss your groundbreaking research on Tay-Sachs disease. To begin, could you tell us what your study primarily focuses on?
Thank you for having me. My study is centered on the intricate biochemical pathways involved in Tay-Sachs disease, particularly the role of the enzyme beta-hexosaminidase A. This enzyme is crucial for the breakdown of GM2 ganglioside, a fatty substance found in nerve cells. In Tay-Sachs patients, mutations in the hexa gene result in a deficiency of this enzyme, leading to the accumulation of GM2 in the brain, which is neurotoxic. However, our research goes beyond simply understanding this enzyme deficiency. We are also investigating the potential genetic modifiers that could influence the severity of the disease and exploring how early intervention, possibly at a prenatal stage, could mitigate the effects of these toxic accumulations. The goal is to identify not just the root causes but also the nuances that may alter disease progression.
That sounds incredibly complex. How did this study begin, Dr. Mihiraa, and what were the initial steps you took?
The study began with a retrospective analysis of patient data from various genetic databases. Initially, we wanted to identify patterns in the hexa gene mutations that correlated with different severities of Tay-Sachs disease. We also reviewed cases of individuals who were carriers of the disease but exhibited no symptoms, which led us to hypothesize that there might be other genetic or environmental factors at play. This hypothesis prompted us to design a longitudinal study, following a cohort of high-risk families. We employed advanced gene editing tools to create cell models with specific hexa mutations and then observed how these cells responded to different stressors, including oxidative stress and nutrient deprivation. These early steps were crucial in setting the stage for our deeper investigations into the disease's mechanisms.
Your approach sounds thorough, but I imagine it wasn't without its challenges. What were some of the most significant obstacles you encountered during this study?
Indeed, the study presented numerous challenges. One of the significant challenges was the limited availability of patient samples, especially for the rarer forms of the disease. To overcome this, we had to establish collaborations with international research centers to access a broader genetic pool. The primary difficulty was the heterogeneity of the disease. Tay-Sachs can manifest in various forms, from the classic infantile type to the later-onset juvenile and adult forms. Each form presents different symptoms and progression rates, making it challenging to generalize findings across all types. Additionally, working with gene editing technology, while powerful, required meticulous validation to ensure that the changes we observed were truly due to the hexa mutations and not off-target effects. Balancing the need for thoroughness with the urgency of finding a treatment was a constant challenge.
With such a challenging path, it's inspiring to hear about progress. What are the latest developments in your research?
One of the most exciting developments is the identification of a potential therapeutic target that could enhance the residual activity of beta-hexosaminidase A in patients with certain hexa mutations. We discovered that by modulating a specific pathway involved in protein folding, we could increase the stability and activity of the mutated enzyme. This discovery was made using a combination of CRISPR-Cas9 gene editing and high-throughput screening of small molecules. Another promising development is our work on gene therapy approaches. We've made significant strides in using adeno-associated viral vectors to deliver a functional copy of the hexa gene to the brain. Early animal studies have shown a reduction in GM2 accumulation and a corresponding improvement in neurological function. These findings are still in the preclinical stage, but they offer a glimpse of hope for future treatments.
Those are indeed promising advancements, Dr. Mihiraa. What do you expect the outcomes of your study to be, particularly in the long term?
In the short term, we hope to validate our findings and move toward clinical trials, particularly for the gene therapy approach. If successful, this could lead to a viable treatment option for Tay-Sachs, potentially halting or even reversing disease progression in affected individuals. In the long term, our goal is to develop a comprehensive treatment protocol that can be tailored to the specific genetic makeup of each patient. This would involve not just gene therapy, but also adjunct therapies that target the secondary effects of GM2 accumulation, such as neuroinflammation and oxidative stress. Ultimately, we aim to shift Tay-Sachs from a fatal neurodegenerative disease to a manageable condition, much like how cystic fibrosis has been transformed by advances in genetic therapy.
The potential impact of your study is vast. How do you see your research affecting the broader field of neurogenetic disorders, Dr. Mihiraa?
The impact of our study could extend well beyond Tay-Sachs disease. Many neurogenetic disorders share similar pathogenic mechanisms, such as the accumulation of toxic substances due to enzyme deficiencies. Our work on enhancing enzyme function and stabilizing protein folding could have applications in other lysosomal storage disorders, such as Gaucher's disease or Fabry disease. Additionally, the gene therapy techniques we are developing could pave the way for treating other single-gene disorders, offering a blueprint for tackling conditions that currently have no cure. On a broader scale, this research could also influence public health policies, particularly in the areas of genetic screening and early intervention strategies. By demonstrating the effectiveness of early treatment, we could advocate for more widespread use of prenatal genetic testing, potentially reducing the incidence of Tay-Sachs and similar diseases in the population. Thank you, Dr. Mihiraa, for sharing such detailed insights into your research. Your work offers a great deal of hope for those affected by Tay-Sachs and potentially other neurogenetic disorders as well. We wish you continued success in your endeavors.
Thank you. It's been a pleasure discussing our research, and I appreciate the opportunity to shed light on this important work. Now look at Extract 2. Questions 37 to 42. You hear a neurologist, Mihiraa talking about the aspects of professional life. You now have 90 seconds to read questions 37 to 42.
Good day, everyone. I am Dr. Mihiraa, a practicing neurologist dedicated to the intricacies of the human brain and nervous system. Today, I would like to share insights into my professional journey. Supporting a patient in neurology requires more than just medical expertise, it demands an understanding of the patient's psychological, emotional, and social circumstances. My approach is deeply rooted in empathy and thorough communication. Patients often come to me with complex symptoms that can be frightening and confusing. My first step is always to listen, really listen, to their concerns. I make sure to validate their experiences, which often include chronic pain, cognitive decline, or debilitating headaches. This validation is crucial, as many neurological disorders are not visible, leading to feelings of isolation or disbelief from others. I support my patients by providing clear explanations of their condition, using language that they can understand, without overwhelming them with medical jargon. This is where my ability to translate complex neurological concepts into relatable terms becomes invaluable. Furthermore, I emphasize the importance of a comprehensive treatment plan, which might include medication, physical therapy, lifestyle adjustments, and psychological support. My role is to guide them through the intricacies of their treatment, ensuring they feel empowered and involved in their care. This approach not only supports their physical health but also addresses their mental well-being, which is often intertwined with neurological conditions. One of the most challenging cases I encountered involved a patient with an atypical presentation of multiple sclerosis, MS. The patient, a young woman in her late 20s, presented with symptoms that initially seemed more psychiatric than neurological, including severe mood swings, hallucinations, and episodes of profound confusion. The diagnostic process was extraordinarily complex because her symptoms overlapped with several other conditions, such as bipolar disorder and lupus, leading to multiple misdiagnoses over the years. The challenge was not only in identifying the correct diagnosis but also in managing the patient's care. Her psychiatric symptoms made it difficult for her to adhere to treatment plans, and she often felt alienated and misunderstood by healthcare providers. I had to work closely with psychiatrists, immunologists, and her family to develop a treatment plan that addressed both her neurological and psychiatric needs. This case required constant reevaluation of the diagnosis and treatment strategy, as her condition was fluid and unpredictable. The experience taught me the importance of interdisciplinary collaboration and the need for flexibility in managing complex neurological disorders. There is one patient who has left a lasting impression on me, a middle-aged man who suffered a traumatic brain injury, TBI, from a car accident. The injury resulted in significant cognitive impairments, including memory loss, difficulties with language, and severe mood swings. What made this patient particularly memorable was not just the severity of his condition, but his unwavering determination to recover. Despite the odds, he was committed to his rehabilitation, participating in every session with incredible resolve. His recovery journey was slow and fraught with setbacks, but his resilience was extraordinary. Over the course of several years, he made remarkable progress, regaining much of his cognitive function and eventually returning to work. The bond we formed during his treatment was profound. It was a relationship built on trust, mutual respect, and a shared goal of recovery. His case reaffirmed my belief in the brain's capacity for healing and the importance of the patient's continued effort and dedication. Neurology is a field that relies heavily on advanced technology. The equipment I use includes magnetic resonance imaging, MRI, machines, electroencephalography, EEG, devices, and positron emission tomography, PET, scans, among others. Each of these tools serves a distinct purpose in diagnosing and monitoring neurological conditions. For instance, MRIs provide detailed images of the brain's structure, allowing me to identify abnormalities such as tumors, lesions, or signs of neurodegeneration. EEGs are crucial for diagnosing epilepsy and other seizure disorders by recording electrical activity in the brain. PET scans, on the other hand, help in identifying metabolic processes in the brain, which can be particularly useful in diagnosing conditions like Alzheimer's disease. The use of these tools requires not only technical expertise but also a deep understanding of their limitations and how to interpret their results within the broader context of the patient's clinical picture. In neurology, effective patient care often necessitates collaboration with other healthcare professionals, such as neurosurgeons, psychiatrists, physical therapists, and social workers. Coordination is key, especially when managing complex cases that require input from multiple disciplines. For example, in stroke management, I work closely with emergency medicine physicians for acute care, physical therapists for rehabilitation, and speech therapists for communication recovery. To facilitate this teamwork, I ensure clear and consistent communication among all team members. This involves regular multidisciplinary meetings, shared patient records, and collaborative decision-making. It's crucial to have a unified approach where each specialist's expertise is valued and integrated into the patient's care plan. Such coordination not only enhances the quality of care but also ensures that the patient receives a holistic treatment that addresses all aspects of their condition. The field of neurology has seen significant advancements over the past few decades, particularly in the areas of diagnostic techniques, treatment options, and understanding of neuroplasticity. For instance, the advent of functional MRI, fMRI, has revolutionized our ability to study brain activity in real time, providing insights into how different regions of the brain communicate and adapt. There have also been breakthroughs in the treatment of neurological disorders. For example, the development of disease-modifying therapies for multiple sclerosis has transformed what was once a debilitating condition into a manageable disease for many patients. Additionally, advances in neurogenetics have paved the way for personalized medicine, allowing treatments to be tailored to the genetic makeup of individual patients. The understanding of neuroplasticity has also reshaped rehabilitation strategies, emphasizing the brain's ability to reorganize itself in response to injury or disease. This has led to more effective rehabilitation programs that harness the brain's inherent capacity to heal and adapt. These advancements continue to push the boundaries of what is possible in neurology, offering new hope for patients with neurological disorders.
That is the end of your OET listening test. Now check the answers.